The political party conference season is over, and both Labour and the Conservatives had things to say about the health service. In this episode, we will be taking apart the speeches from Wes Streeting and Steve Barclay, Shadow and Secretary of State for Health, respectively. Given everything that's happening in the world at the moment, you may be forgiven for not having caught these speeches. So we will recap them for you, and you can learn everything that they've been saying in their party speeches about health, general practice, and the NHS. Let's go. Hi, Gandhi. How are you doing over there?
Yeah, ticking on, Andy. Yourself?
Yeah, not too bad, actually. Yeah, it's been an interesting few weeks. Lots going on. I guess today we'll kind of focus on business, really, and the business of general practice, and having a look at what the parties had to say in their conference speeches. So, yeah, keen to have a look at this, Gandhi?
Definitely. So obviously last episode when we went live, we talked about all the various other kind of conferences that have been happening, things like Best Practice, King's Fund, RCGP, and a few other updates. So feel free to go back and check that episode. But we did mention that we were going to talk about the party political conferences in more detail. And absolutely, we're going to have a look at that right now for you all. So let's bring on the stuff that you've got there, Andy. Tell us what's been happening.
Yeah, so first of all, just to remind people who the people are, this is Steve Barclay. He's the Secretary of State for Health. He's a Conservative minister, and the Conservatives have had their party conference recently. He gave a speech on health. We'll be looking at that in a minute. And then this chap is Wes Streeting. He's the Shadow Secretary of State for Health and Social Care, to give it its full title. And Labour had their conference last week as we're recording it. And he also has some things to say about health. And I think it's really interesting to look at these speeches because, the NHS is a government organisation. What the politicians in power at the time say they will do and what they subsequently do, to and with the NHS has a lot of impact on our working lives and, the lives of patients using the NHS. So I think it really is interesting and important to have a look at what they've had to say. So,
yeah, definitely. I think it's important, like you say, to remember these are often the tones that they set for what's going to be coming. Obviously, Wes Streeting as a shadow secretary, potentially what Labour may stick in if they were to win an election. Obviously, Steve Barclay, current incumbent health secretary. He's been in post for almost a year now, so he's lasted a lot better. Obviously, this time last year, we'd had a change of about 3 in the previous 2 or 3 months or so, haven't we, Andy? So
yeah, there never seems to be a month without us doing a profile of a new health secretary, but he's been pretty steady in the job actually since the Rishi Sunak reshuffle. I think it was Theresa Coffey before, wasn't it? And she was shuffled out for Steve Barclay when Rishi Sunak came to power. So what has Steve Barclay had to say in the conference speech? So it's about 1,500 words. So not a long speech. And I guess let's dive in and we'll just react to some of the key statements that we highlighted prior to going live, really. So there's a focus in Steve Barclay's speech on boosting capacity, expanding the workforce, embracing new technology, tackling waiting lists. Later on, it does go into some social issues as well, which is where a lot of the headlines around this speech have been drawn from, I think, particularly in Daily Mail, Telegraph. He says some things about the use of pronouns in the NHS, which is interesting, I think. What he also talks about is those people standing in the way of change, and the PMA feature as the target for those comments as well. So they get straight in and they talk about the militant union leaders and Labour MPs supporting strikes and being on the picket line. So they're firmly voicing their opposition to the strikes, which obviously they oppose.
And important to remember that when he gave the speech was actually one of the strike days as well. So I think there was probably some undertones in that sense when he gave that particular speech.
Yeah, and it is an important issue, and it's difficult for him not to comment on that. I think really gets right in there with some figures. Talks about putting 800 new ambulances on the road, 5,000 permanent hospital beds, creating 10,000 hospital at home patients for patients to stay. So I guess government and opposition like figures and saying how much new this or that is there, and there's certainly that in this speech. They talk about both both speeches talk about technology, and they talk about that as an opportunity to help tackle the problems in the NHS. Steve Barclay, in particular, highlights AI to speed up the interpretation of brain scans, and pledges to put this in place in the near future to assist with diagnosis of stroke and other neurological conditions. Just an interesting specific example. One wonders how much role government or opposition play in the deployment of these technologies, personally, and whether they were coming down the line anyway, and might, and have they really been developed through government? I don't know. Choice features quite a lot in this speech as well. That's one of the words that keeps coming up. Patient choice, and they talk about a choice between different healthcare providers, including independent providers, and they want to give patients a choice of where they're seen, including independent providers, following referral from a GP, which I think is interesting. I mean, in some ways that already happens. There's a lot of extra capacity provided in private hospitals purchased by the NHS, so maybe they're talking about something similar to that.
Possibly. I mean, the choice aspect keeps coming up, and I think there's been a couple of things that have shifted the choice kind of discussion, hasn't it, more recently? So, as you mentioned, the capacity and the backlog, so people having the option of going to other providers for certain parts of their healthcare and having that stitched up. I think there's an element of choice that comes into certain pathways. So we know about things like gender dysphoria and stuff, and ADHD. Treatments that many people are looking at the private sector in particular for support with those kind of things because of the significant backlogs in those pathways and things. But also just around, even a second opinion. So there was that recent thing about patients having a second opinion, even in an urgent situation. I can't remember the name of the law or whatever.
So the right to a second opinion they were talking about.
Effectively. So bringing that choice agenda, which is great. I think it's really important. I think, as ever, devil's in the detail. How do you make this viable and sustainable? Part we don't seem to cover, but obviously that's not what a political speech is about, is it? It's about the change.
These are often, rousing events, speaking to a select audience. Actually, they're speaking to their party supporters at a party event. So I think you have to take that into account as well. So I think what was more widely covered was the 30 million fund to speed up the adoption of new technology in the NHS. The aim to look at proven or near proven technologies and get those improving patients' experience of the NHS and patients' quality of care as quickly as possible. That was widely covered, and that was announced in this conference speech. They talk about the NHS long-term workforce plan, the first time that the NHS has had a long-term workforce plan, and they talk about the expansion in training places that were described in that plan. And we've done a video about that plan, and talked about how we feel about it. It's true, we haven't had that sort of that plan before. Devil's in the detail in terms of what is it doing to help retain. Without reliving our previous video, perhaps, was there enough attention on retention? Was there enough attention on estates and where to put these people? And was there enough attention on how we're actually going to train them whilst clearing backlogs? Existing staff have to train the additional staff. But they acknowledge that. They acknowledge additional medical school places that are coming online right now at medical schools in more sort of hard to do parts of the country. Worcester, Chester, Brunel. So maybe there may be more harder to do places, I guess. They talk about the piloting of medical degree apprenticeships. This was all in the NHS long-term workforce plan. So that's actually allowing people to get a medical degree through an apprenticeship program rather than going to university, which is interesting. I'm quite interested to see how that works out, actually. Did make me reflect that, I guess, previously, and a little bit before our time, people from a hard to do area might be able to get a student grant and free student tuition, which enabled them the social mobility to go and get a traditional medical degree. But that's obviously not there anymore, and that's not how they're choosing to address this inequality issue in terms of access to medical education. But there we go. They're bringing in an ex-chief executive from Marks and Spencers to scrutinize departmental spending and reduce waste. Wes Streeting also talks about efficiencies, actually, or reform. Reform is the word that Wes Streeting used, but they want to look at reducing waste, and that's the word they use here, and there's lots of opportunities to reduce waste, although that's always the answer. And I'm not sure there's how much waste there is left. I'm sure they can find some. So they want to spend, so that's less money on the back office. That's where they're cutting, more money for the front line. Okay, fantastic. And then there's a large section which has been reported widely in the Daily Mail, Telegraph, and others kind of similar, I don't know, right-wing media sort of newspapers, or ones that we'd associate in that way. And they talk about not spending huge sums of taxpayers' money on diversity consultants, hiring bloated internal diversity and inclusion teams. So they're really sort of railing against diversity. They talk about reversing changes to the NHS website that removed references to women in connection with cervical cancer. So I think these were issues around pronouns that were around the NHS websites. There's a large portion of the speech spent on this issue, which is important to a lot of people, I guess, on both sides, in an area where there can be, I guess, division of opinion. But in terms of actual spending, numbers of staff, it's not about that. Those things that will really move the needle in terms of impact on the outcomes from those big kind of 6 disease areas that are in the major conditions framework. So it's just interesting that they devote a lot of attention to that, really. Then he moves on to the militant BMA leadership, whose strikes have resulted in countless cancelled appointments and pose a serious threat to the NHS's recovery from the pandemic. So really has the BMA in their sights. Consultant and junior doctors relentlessly demanding massive pay rises. Doesn't end there. They're even threatening to take the government to court over plans to let patients see their own test results on their own phones. I don't know if that's quite right, because I believe that's actually possible at the moment, but
it is. I think whether that's more around the mass opening of prospective access rather than the more sensible option of controlled opening and stuff, which I know many people are concerned about for within the profession and stuff, but I wonder if it's more to do with that, and it's an adaptation of the wording to make it sound a little more controversial, shall we say.
Yeah. And then clearly shows the BMA leadership is not on the side of change. They are not on the side of patients. And then they move to attack some of what Labour have been saying about their plans for health. In particular, Labour have proposals for, I guess, what they would describe as nanny state interventions. Labour would describe as restrictions on, advertising of unhealthy foods, for example. So there are some specific examples about banning pictures of strawberries and cream on the Underground by Sadiq Khan. I don't live in London. That's not an issue that I've been aware of, but really quite some specific things. They attack Labour's record on health in the Welsh Health Service, where Labour are in power, and then they finish just sort of highlighting what they feel are their main threads or points, which stand up to the BMA leadership. Let's challenge the ideologues who silence the voice of women. Not be lectured by a Labour Party who have failed in Wales. And that's the Conservative speech. I guess we might want to look at Wes Streeting's speech now and then contrast the two. Unless you have anything particular to say at this point, Gandhi.
No, I think it's a rather interesting speech. It's a lot shorter than I thought we would anticipate from someone in such a prominent position and stuff. And there's some stuff in there. So the tech fund, that was much commented on. And interestingly, that the applications for that tech fund are ridiculously short. I think they have to be in by the end of October or even sooner than that. So it's a really short time frame about more resources for the NHS and stuff.
Quite a small sum of money as well.
It is quite, I mean, compared to some of the other ones. So I know that there's been other funds announced about more longer term plans, and they're like 10 times the amount that is mentioned here. So it doesn't come across as much resources. It's more about reform and that kind of stuff and things. But you're right. He takes a big swipe at the BMA within this speech and stuff, and also starts setting the tone for a couple of pops at Labour and stuff as well, isn't there?
I think so. I think we're seeing a bit of maybe anti-wokeism, and they're really rallying against the BMA. Probably being aware of the people who were attending the conference and in the room, I guess, and very much for that
Yeah.
audience. And I don't really expect them to set out their kind of whole health policy within these speeches, which are designed for a conference audience. So moving on to Wes Streeting. So he takes a handover from somebody called Nathaniel, who must have been talking about having a difficult experience within the NHS. Wes talks about owing his life to the NHS. They were there when he needed it. He acknowledges that the NHS is facing significant challenges in terms of large waiting lists, the largest ever. He mentions the strikes. Says there's a window of opportunity for negotiations before the next round. So he's sort of highlighting, I guess, that there is a ball in the government court if they choose to play that ball and talk to the BMA. They talk about how they would take immediate action to cut waiting lists. So they're putting some figures behind it. So, an extra 1.1 billion to beat the backlog with extra clinics at evenings and weekends. So a fairly specific proposal. They talk about how they would pay for that. Obviously, we've not ran the maths in the background, but they want to abolish non-dom tax status to bring in extra tax revenue to pay for that. They specifically mention the crisis in NHS dentistry, which we have talked about a few times on the podcast. Very difficult to find a dentist in some parts of the country. People resorting to DIY dentistry is described. And actually, I've had patients who've described doing the sorts of things here, pulling their own teeth, things like that. I've had patients tell me that that's what they've done. So they want to get the NHS back on its feet, fit for the future. Talks about reform. So reform and investment, which is where the Conservatives, I guess, talked about waste. They talk about reform, and that's the language that they're using around it. Actually, they do use waste. A waste of money we don't have. So pouring money into a system that isn't working, is not a good use of resources. So they want to reverse that. They restate their pledge to keep this a public service free at point of use, and they're very committed to that. Acknowledge that the NHS is no longer the envy of the world. We've seen it drop down the standings in the Commonwealth ranking of health services. We've documented that on the podcast before as well. They just want to highlight that they've noticed and they want to do something about it. They talk about, in some ways, these are quite sensible things which have come out which are present in a lot of the government's own other documents that have been produced. But they talk about a need for increased use of digital tools. They talk about a need to focus on prevention rather than dealing with problems when they arrive. Move from a sickness service to a health service. And they talk about too many lives lost to the biggest killers, which actually feels like they're referencing the major disease framework that we talked about a few weeks ago as well. They talk about the demographic problems facing the NHS that threaten to overwhelm it, increasing aging society, rising chronic diseases, and then they come to Labour's reform agenda that will turn the NHS on its head. So move from a hospital service to a community service, analog to digital, sickness to prevention. I see the word neighbourhood in here, so we're sort of neighbourhood teams are talked about, and it's interesting that the word neighbourhood health service is here. They reference Sussex GPs working together to provide specialists in urgent care in the community. I think the Sussex model is referenced in the Fuller stock take, I believe. They talk about primary care. So the Conservatives didn't mention primary care. Labour mentioned primary care. So primary care will be at the heart of Labour's plan for the NHS. We'll train thousands more GPs and cut the red tape that ties up their time. The Tories in their NHS long-term plan actually talks about training thousands of more GPs, but he didn't talk about that in the talk. Labour will bring back the family doctor. And then they talk about improving the opportunities for children to reach their potential, to live out the century, and live with less burden of ill health. They talk about supporting social care as well, that in order to support the NHS, social care also needs to be supported. They talk about a fair pay agreement for social care workers. And then they go on to talk about technology. The specific example given here by Wes Streeting is a little bit more specific, I guess, than the one in Steve Barclay's talk. Talk about artificial intelligence identifying signs of eye disease on scans, and they talk about work being done at Moorfield Eye Hospital, which I think is interesting. We're nearly there, Gandhi. They want more scanners. They want to double the numbers of scanners in the NHS. So quite specific things here, and use genomics and AI to predict and prevent illness in the first place. A transformation of the national health system must go hand in hand with a transformation of the health of the nation. This is where they talk about work to support health in children specifically, and perhaps some of those things which other people might see as nanny state interventions. So they want to ban junk food, ads targeted at children, breakfast clubs for children, supervised toothbrushing for children to improve their dental health, tackling the vaping industry. And they also say that they proposed abolishing the sale of cigarettes, something later adopted by Rishi Sunak to phase out the sale of cigarettes to people in the United Kingdom. So he's kind of just acknowledging that. I guess if we just skip to, I know people will be interested to just reach the summary really. So just to summarize, he summarizes the speech very nicely at the end. They want to provide 2 million more appointments to cut waiting lists, 700,000 more appointments with NHS dentists, mental health support in school. That's something that was mentioned in the children's section. Mental health hubs in every community, double the numbers of scanners, the biggest expansion of NHS staff in history, more doctors, more nurses, more midwives. NHS is there when you need it, get it back on the feet for the future. So perhaps striking a, maybe a more optimistic tone towards the end of that. So we've heard the two speeches. Any reflections or contrasts on them, Gandhi?
I think the key thing for me is that Steve Barclay's is, like you say, it's shorter, it's more specific around current challenges, and in particular, he takes some pretty big swipes at three main areas. So, woke concepts, he takes swipes at obviously the BMA, and he takes swipes at Labour. And his speech is more negative in tone compared to, I guess, Wes Streeting's much more positive, looking at, I guess, specific changes to make. It does lack some stuff. Obviously, there's no comment as to how Wes Streeting plans on funding all of the stuff that he's talking about, the expansion of almost every part of every possibility. Well, there's the absolute question: how is it going to be paid for?
Well, he does talk about abolishing non-dom tax status, and actually elsewhere in the speech, he does talk about it's something to do with private education funding and raising tax on private education as well, either removing the VAT or the charitable status.
It's just I've heard similar things in a lot of their other comments. So how much of that funding is being used for everything? It's
one of those situations where one thing is paying for all sorts of different things, and it doesn't add up. Yeah, it's difficult. We've not got our calculators out here.
No, and absolutely, we're not going to get those kind of detail from party political conferences. It is about the bluster. It's about the headlines and the sound bites and that kind of stuff, because it's about trying to target their audience, which is obviously party members and conference attenders, to try and drive home some of those things, as well as obviously the media and that kind of stuff. So definitely different tacks. I guess one thing I'd probably comment, so people may have saw this flash up whilst we were talking, but I wanted to bring up this really interesting infographic that I guess in terms of Steve Barclay's kind of comments about the strikes and that kind of stuff. So this is by a colleague of ours, Dr. Steve Taylor, who runs something called NHS Facts and Stats. It's a great page and stuff. He loves, he's far better than I am in terms of illustrating data around the NHS and stuff. And I guess for me, that this exemplifies actual stuff. It's, in terms of, if you look at the number of appointments, 100 million appointments in terms of hospital stuff and things, how many of them are actually cancelled by patients? About 9 million. You've got how many cancelled by the hospitals, how of them are provided extra by doctors working beyond their contracted capacity, and then finally how many were actually cancelled due to the strikes. Really interesting infographic that shows actually the level that if we have fixed the way that the NHS actually works, how much more capacity could we actually provide in comparison to these constant sound bites about the strikes being the reason why people aren't getting cared for and stuff, which is actually as we can see, not true really. But yeah, just wanted to bring that one on, a bit of a shout out to Steve and stuff, because he's doing some amazing work out there and stuff. But what did you think, Andy?
Yeah, I think they were quite different speeches, really. I think Steve Barclay was more speaking to the people in the room and what was perhaps important to them, and more traditional Conservative voters, I guess, for portions of the speech. I think he probably could have said sort of more positives about things that the government is doing. There are the NHS workforce plan could have perhaps been talked about more, and there are other documents that we've covered that have come out recently that have sensible suggestions for improving the NHS that could have been referenced more a little bit, really. So I think you had the opportunity to perhaps lean into those things a little bit more, rather than what people in the room would have been more drawn to. The Labour speech sort of feels like it's written for more of a general audience, the people out there, part of the general population just watching on telly. So there are more specific interventions suggested. So it feels like it's designed to appeal to a more mainstream audience. I guess, as you say, the Steve Barclay's speech took some swipes or targeted people as the source of problems in terms of the BMA, junior doctors, consultants, and woke type culture. And Wes Streeting's speech, didn't really attack anyone apart from the government and their record. So, so interesting. I guess people will make what they will of these speeches, and there'll probably be a lot more water under the bridge before we vote for our next government in the next general election, whenever that is, in 2024 or early 2025. But it's interesting to see the general direction that they're heading in.
Definitely. And I guess if you want to give us your views, we would absolutely love to hear them and stuff. So why don't you stick them down below in the comments and let us know what you thought of the two different speeches, our analysis, summary, comparison, whatever you want to call it, and stuff.
Chat about it.
Chats, let's call it that, yeah. And definitely let us know what you think and stuff. And if you did want to check out that other kind of content we put out about the other kind of conferences and stuff, then definitely do check out the video that's coming up about here, probably right now. And as always, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode.